It's a common problem for pets, okay? It's one that a lot of us don't really feel comfortable talking about, certainly not on live television. Guess what? We're going to talk about it. Your dog or your cat scooting their backside on your carpet, and you're like, what are they doing, especially around guests? You're like, please stop. Joining me live is Dr. Spicer, James Spicer. He's a vet with Indy Vet to talk a little bit about this. Hey, why do dogs and cats do this, first of all?
Well, if your dog is scooting, more often than not, it's going to be as a result of either inflamed, impacted, or infected anal sacs. Now, the anal sacs really are two small sacs located one on each side of the anus, and they're within a muscular wall. And these sacs gradually fill with secretion from glands that are adjacent to these particular sacs. These are the same things that skunks use for a defensive measure, but dogs and cats no longer have that particular measure that they use. But they're present in both male and female dogs, and they normally empty when pets have a bowel movement. However, the ducts can become occluded with dried material that can be contributed to by constipation or diarrhea, chronic skin conditions, obesity, low thyroid function. All of these things can cause a situation where they don't really empty properly. And most of the time they just fill and they are uncomfortable to the pet and they need to be expressed. But they can also get infected and can abscess. But they are uncomfortable when they get overly filled, and pet owners can learn to express them, although it's pretty stinky business, and it can be a little bit uncomfortable for the pets as well. So you may want to leave that to your veterinarian. But rarely they need to be sedated for this unless they're really uncomfortable. If they are infected or inflamed, sometimes they need to be instilled with medication in order to really manage the problem. But it is kind of a very common problem, and as you said, is one that we don't tend to want to talk about too much.
No, and especially not when you've got some middle school boys in the room or those that are acting like it. And I just got lucky with the segment because Ray typically does this segment, and he's the one that said he has a dog that has the issue. My dog does not do this. But anyway, let's talk about when do we need to bring them? I'm just going to tell you right now, my dog has this issue. I'm not helping it. I'm bringing it to you.
That's wise. Very wise. Otherwise, you may smell bad the rest of the day.
Okay, so when do I need to get treatment?
Obviously, if they're uncomfortable or they're doing this, sometimes they'll scoot and they'll, accomplish the job themselves, and you'll know it because you'll smell it. But if they don't and they continue to be uncomfortable, they're licking back there, they clearly are scooting all the time, it's probably worthwhile to take a trip to the veterinarian to have that handled so that it doesn't go ahead and become infected or abscess, which is a whole nother level of problem back there.
Oh, hey, we sure do appreciate you hanging out with us this morning. I mean, again, it's a serious thing. A lot of people have dogs and cats. This happens too. So now they know, and they know how to get help. We appreciate it, Dr. Spicer.
You bet.
Yeah, for a list of the services and the education opportunities. I mean, if this isn't why we're number one, I don't know why we would be number one in the morning. Indy Vet Emergency and Specialty Hospital, fox59.com/links. More information there. Hey, Ray.
It was really helpful, Ange.
Now you know.
Now I know. I'm glad that you did that because